Fewer kindergartners are getting vaccinated for measles. The CDC says only 92.7% of US kindergartners got their shots for the last school year. That's down from 95% that had been maintained for about a decade. Joining us now to talk about that and some other health topics today is Dr. Bill Hartman, clinical trialist at UW Health. That 95% threshold, is that what the CDC wants to see?
That's what they've mandated really for the last 20 years or so. And we haven't seen diseases like measles really creep up in communities like it has the last couple of years. This dipping below that 95% threshold, even though it's only down to 92.7, those couple percentage points translates to over 100,000 new kindergartners going to school without all the vaccines they need. And this creates an opportune environment for illnesses to attack these kids and to make our community sick.
Is there any literature that explains why they think that rate went down? Are people more reluctant to get vaccines? Do they have vaccine fatigue since the pandemic? Or is it kind of just, forgot?
No, there's definitely a vaccine fatigue that happened since the pandemic. There's also a very powerful anti-vaccination movement throughout the United States, throughout the world, really, that is very active on social media, that often frightens parents to go ahead and vaccinate their kids. That being said, these vaccines that we're talking about, MMR here, this has got a decades-long safety profile, and it's been very effective in our country, almost eradicating measles until these last couple of years when it started to really creep up in communities that have dipped below this vaccination threshold.
You bring up a really good point about there being kind of this wave of anti-vaxxers or just being against certain vaccines when it comes to especially social media, like you mentioned. As a doctor who lives in this space, and you have for many years at this point, what is your reaction, even as a parent, right? I know you have a bunch of kids, even as a parent, when you see people kind of speaking towards leaning that direction?
Oftentimes I try to figure out where they're coming from. Why do they feel this way, and why do they feel that they have to scare other people into thinking as they do? So the only way to really combat that is to get out there, to tell the truth, to show them by example, vaccinating my own kids, that this is the way to go. This is the way to keep your kids healthy and safe. This is the way to keep your communities healthy and safe.
Speaking of vaccines, we've entered that time period when flu and COVID vaccines are being given once again. And there's some new research that shows there's a benefit to getting the COVID vaccine when it comes to developing heart issues. Can you explain this one?
Well, this is probably because the COVID vaccine really helps prevent people from getting serious illness to the point of hospitalization once they contract COVID. With repeated COVID infections, we don't know what the combined effect of all those infections are going to be. We do know that COVID can cause problems with the heart. It can cause hypercoagulable disorders. And so the vaccine likely prevents that because it prevents you from getting seriously ill from COVID itself. And right now, we're in that respiratory virus season. It'll probably peak sometime between December and March. But it's a good time to go out and get your flu shot, your vaccine for COVID, and your vaccine for RSV if you feel you need it. But this is the time to do that. It takes about 2 weeks for those vaccines to kick in, but that'll give you lasting protection throughout the season.
Good stuff. Dr. Bill Hartman, we always appreciate you taking the time. Thanks.